Okay, this is the last part of our anaerobe lecture, and this is a very short lecture. We're going to finish up our anaerobes and talk about the last group, which are the gram-positive cocci. And the genera of clinical importance in the anaerobic gram-positive cocci are Peptostreptococcus, Feingoldea, Micromonas, and the anaerobic Streptococcus organisms. So here's a flow chart of the gram-positive cocci. So you'll first want to look at your macroscopic morphology, and if the colony is black, it would be a Peptococcus niger. If it is not black, you would want to look at the results of your SPS disc dropped onto your plate. If it is susceptible, the organism grows right up to the SPS disc, it is likely a Peptostreptococcus anaerobeus. If it is resistant to the SPS disc, you'd want to do a spot indole test. And we talked about the spot indole test a while ago when we were talking about the Enterobacteriaceae organisms and the other gram-negative bacilli. If your spot indole is positive, you would do a nitrate reduction test, and then that is going to differentiate your Peptostreptococcus organisms. Now, in the clinical lab, you're not going to do some of these individual tests, and you may not even need to go down to the species level for some of these organisms. Some you definitely do, but a lot of times you have an idea of what the species is, like for your Clostridium, based on the types of infections you're seeing. For the gram-positive cocci, if there's no difference in the treatment, it's not so important to know exactly what the species is. If you know it's Peptostreptococcus and you know that all of the species are treated with certain antibiotics, that's what the clinicians are looking for. They want to know what it is and how do I treat it. So we do have our diagnostic instrumentation. Some labs use the Vitex, some labs use the microscans. There's other instruments that are out there, and they have different programs that can be put in for various types of organisms. So you can set them up to run tests for anaerobes. So, but even though the instruments might be doing some of these tests, you need to understand what test the instrument is doing and how is the instrument figuring out of all the hundreds and hundreds and hundreds of thousands of possible organisms that it's this genus and this species. And these are the types of tests that the instruments are performing. So here is a gram stain of Peptostreptococcus, and like your Streptococcus organisms that we talked about a long time ago, these are gram-positive cocci that tend to chain together, so that chain formation. Now, Peptostreptococcus is normal mouth flora. It can cause a brain or a mouth abscess. Any mouth flora, as you already know, can get into the bloodstream, especially in an immunocompromised individual, and cause a cardiovascular infection, your endocarditis. And usually this is more common in individuals that have heart issues, underlying heart disease, they've had heart valve replacement, they have poor dentitia, poor oral hygiene. Those types of things will be more common risk for cardiovascular infections caused by Peptostreptococcus. Now, whenever you are considering an anaerobic infection, there are certain things you always want to remember. You want to remember those characteristics of the anaerobic organisms, those certain bacteriological clues. So those clues are that anaerobes usually are very foul smelling. So if a person has a deep wound infection that actually smells, that is very oozy, where the tissue might be necrosing, where you have things like gas gangrene or flaccid paralysis, these very diagnostic symptoms for these specific anaerobes, those are going to be clues that you might have an anaerobic infection. So you always want to read your case study very clearly, because sometimes the area of the infection, if the case mentions the word abscess, you always want to think anaerobe when you see the word abscess. It doesn't mean it's always an anaerobe, but it's an anaerobe has to be considered in certain types of infections. You want to always consider the morphology. So your double zone of hemolysis for your Clostridium perfringens, or your brick red fluorescence of your Porphyromonas and Prevotella. And you also always want to know those presumptive tests that can allow you to differentiate one organism from another. So your disc antimicrobial tests, for the anaerobes, it's the bile, the SPS. You always want to consider some of these things when you're reading a case study, or thinking of, okay, we have this specimen that came in. What is the specimen? It's asking for an anaerobe. What are the common organisms I might identify from this specimen? And then to perform the tests and always inoculate the appropriate media, and always to put your specimens in the appropriate environment. So if you're doing anaerobic culture, you always want to use your anaerobic plates and put those plates in your anaerobic chamber. So we're going to end with a case study. There's a 45-year-old male farmer seen at the hospital for complications from a traumatic injury to his left leg. On examination, his leg was bluish. It was edematous, meaning very swollen, has a lot of fluid in it. The patient was in a lot of pain. The CBC showed a marked increase in neutrophils now, and the total white blood cell count. Some of you may have not taken hematology yet. If you're a BS or CLS certificate student, you will take hematology, or maybe some of you have already had hematology 1. For those of you that are in the micro certificate program, you may not have had, you're not going to take hematology here, but hopefully you have taken immunology, and you know that whenever there's an increase in white blood cells, one reason can be maybe a leukemia, a type of blood cell cancer, or another reason might be that the person has an infection. If you see an increase in neutrophils, it is commonly indicative of a bacterial infection. If you see an increase in lymphocytes, it's commonly indicative of a viral infection. If you see an increase in eosinophils, that's usually indicative of an allergic reaction or a parasitic infection. So those are important immunological things that all microbiologists need to know. So right now, you're reading this case. This person has a traumatic wound. There's a lot of organisms. You should be able to list off at least 20 organisms that might be causing this infection. Some of them anaerobes and some of them facultative organisms. The minute you see that the CBC has an increase in neutrophils, you're thinking bacteria. Now we're going to move to the Gram stain. Numerous gram-positive bacilli. Okay, in your list of organisms, what matches a gram-positive bacilli? Oh, there's also gram-positive cocci in clusters. Now, I'm hoping all of you are thinking the same thing here, gram-positive cocci in clusters. What is that usually indicative of? Hopefully you're all thinking Staphylococcus. There's few leukocytes, white blood cells, showing in the direct gram stain of the wound specimen. Now, initial interpretation was an indication of contamination rather than infection. And why do you think that? Why would you think that there might be an indication of contamination? The only thing I can think of are those gram-positive cocci clusters. Your Staphylococcus organisms are common skin flora, which would mean that your specimen may be contaminated with some skin flora. So why is it important to determine how the patient acquired the infection? Well, that's going to give you a clue as to what potential organisms might be there. What are the possible sources of infection of this type of wound? Well, we don't really know how this individual got the traumatic wound. If we did, we might be able to even identify sources a little more definitively. So if the traumatic wound was that the person stepped on a old piece of wood out in the backyard that punctured through his foot, well, we'd all automatically be thinking of some anaerobes here. You always want to consider how the organisms are going to get into the body, how they might cause an infection. You always want to look at the gram stain. You know, if the gram stain is going to allow you to rule out organisms. When you're reading a case study and it says that the gram stain is a gram-positive bacillus, well, you should be able to go in your list of possible answers, and if any of those answers are not a gram-positive bacillus, you can cross those out and increase your chance of getting the right answer. Now, unfortunately, if all of the answers are gram-positive bacilli, well, then you've got to look at some of the other things in the case study that are going to allow you to identify the correct answer. And usually those things are going to be some of the biochemical tests.